Well, let me just add to what you've just said, Gary. Jack Kinsella in Canada was also a victim of what you just described. He had constant illness, couldn't get treated. He ultimately died of it, and that's the scenario of socialized medicine.
It is, not to speak of the higher prices, the greater bureaucracy, less privacy. I have said before, in my opinion, this is the single biggest step could have taken at one time toward a socialist state. And there's no other way that the government could take over this large a chunk of our economy and our lives, really, in one chunk, other than through the healthcare system.
Jan, you know, I have friends in Canada, lots of them. I traveled up there extensively in the 1990s and early 2000s and still go up. And they're saying we're scared because we don't know where to go. If we have some sort of a deadly disease and we're on a list, we always came to the United States and paid for it ourselves. And they said, you're dismantling the very system we've depended on up here.
Well, here's the point I'm trying to raise in this particular interview anyway, and that is its invasion of privacy, because that's kind of where we've been with Gary and where we're continuing to go with Gary. I want to play a 2-minute soundbite on this invasion of privacy. I don't think most listeners are aware. Folks are going to come into your home to ask you questions that are none of their business.
Obamacare may soon be knocking at your door. Literally, a brand new federal program will spend $250 million, $224 million taxpayer dollars to send government home inspectors to your house, saying the program will help at-risk kids. So is Obamacare trumping your right to privacy, snooping on you and your family? Stuart Varney says yes, it sounds like it.
Yes, it is. This is a new opportunity for the government to snoop on you. This is a greater opportunity for an intrusion directly into your home and the way you raise your children.
Explain what the home snooper is going to do.
Okay, this is, you can knock on the door. Ding dong, here we are, unannounced, a random visit, if you have certain risk factors associated with your home.
All right, I'll be at home. You be the Obama snooper. What are you going to ask me?
Good morning, Mr. What's your name again?
Ducey.
Good morning, Mr. Ducey. That's right. Morning, Mr. Ducey. I understand that you use tobacco in your house and you've got young children in your house. May I come in and take a look around? Because your child is at risk. Good morning, Mr. Ducey. I believe that you are a gun owner, registered or otherwise. I'd like to come in and check out the security arrangements for your children in your house. And by the way, taxpayers are going to pay for this intrusion into your home and your privacy and how you raise your children.
You know, my first inclination would be to answer none of your business. But the government doesn't take that for an answer, do they?
No, it does not, because you have placed your children at risk. Therefore, you are subject to a random, unannounced inspection of your home by the Obamacare people.
Okay, so that information, whether there's a smoker in the house or you own a gun, that's going to now go into a federal database, right?
That is correct, yes, along with a lot of other data about you and your family, and you now have this opportunity for intrusion direct into your privacy. Look, to me, this is the exact opposite of what America stands for. Surely America is individual liberty and freedom, not the intrusion by the government knocking on your door wanting to inspect your property. That's a big deal.